My name is Lauren. I am 29 from Marshfield, Wisconsin. I was diagnosed with COVID at the beginning of November of 2020. It was kind of just a whirlwind of emotion from there and just getting sick. I didn't know how to feel. I had every single symptom that they had listed as a possibility. And I remember from probably about the second day feeling like I was going to die. I couldn't breathe. Everything felt wrong. Nothing I did made anything better until about a week in, and there was a light on the other side. I felt better. I could breathe again. Life was getting back to normal. Probably about 36 hours after being released from the county, after having no symptoms, no fever, anything, I started having trouble breathing again. I couldn't walk upstairs. I couldn't walk to the end of the driveway without going into heavy fits of coughing and just not being able to breathe and feeling like I was going to pass out. I'd get really lightheaded. I would start tipping over. I had a very unsteady gait. Finally went into the hospital, and I had to physically fight for my health and my life at the clinic. I went in through urgent care after being sent there from the emergency room. The doctor tried to dismiss the whole thing as post-COVID syndrome, and I told him something was wrong, it wasn't right. And he kept trying to say, this is normal, go home, you'll be fine in a few days. Finally, after insisting it wasn't okay, he told me that he would run a blood panel to ease my mind. Less than an hour later, he came back, told me that my D-dimer, which is the clotting agent in your blood, was slightly elevated, and that they were going to essentially rush me to go get a CT scan. They brought over a wheelchair, a transport person came down within minutes, and I was brought up to the clinic side to get a CT scan. About 10 minutes after the scan, the doctor had returned to the room after receiving a personal phone call from the radiologist that had reviewed the scan, saying that I had bilateral pulmonary emboli, a ton of other clots in my lungs, a strain in my heart because the artery was completely blocked off from that blood clot, and pneumonia. A few minutes after receiving this news, I obviously broke into tears. It became a realization that at any moment my life could no longer be mine, and that I could obviously pass away. I had called my brothers, letting them know what was going on, and more of like a heads up, and I love them in case I didn't make it. Crap. And from there, I feel one of the most upsetting things was that a nurse had come in to show me how to do an injection that I had to do myself twice a day. And they gave me a prescription for warfarin on top of this injection, and they sent me home. No further contact, just sent me home, follow up with your primary doctor. I had to continue doing injections for 3.5 weeks before my blood was thin enough to just continue taking pills. Through all of this, every day I wasn't sure if I was going to live. After the original diagnosis, I had contacted my brother, grabbed my dog, and essentially enough things that I could carry myself, and had moved in with him for a couple of weeks in case anything had happened, and given my limited mobility, so to speak, because I couldn't breathe. While living with my brother, I had constant medical appointments. I was going to the clinic 2 to 3 times a week to have my blood levels checked, just to make sure that they were within therapeutic range. This continued on until about mid-December, when I was finally removed from giving myself shots, but I still had to continue the pills and continue to go to the clinic at that point about once a week. After that appointment with the doctor, everything seemed to kind of calm down. My blood levels were within therapeutic range. I was starting to feel a little bit better. I could walk to the end of the driveway without being super short of breath. I could, take my dog outside for more than 2 minutes at a time. And then the end of December came and I had gotten sick again. Every single symptom to where when I had gotten sick again felt like pneumonia all over again. I had brought this up to my doctor at a later date, and he again said it was probably pneumonia, given that my lungs were very compromised at the time. Finally got around to 2021, started feeling a little bit better again. And they were finally opening up the vaccines for people to be able to get. Waiting for my round to come, I had ended up getting sick again with what we believed to be bronchitis. Again, because my lungs were in a very compromised state, this isn't unheard of. I was going to get sick and I'm going to continue to get sick. But that meant that I needed to wait at least another 3 weeks until I got the vaccine, as you can't be sick before it. Then I started blacking out around mid-January, February. Not remembering what had happened, having to have multiple appointments with my primary in neurology, and they weren't exactly sure what was going on. And they had diagnosed some sort of sleeping disorder and a possible seizure disorder now that they are bringing back to COVID. Thankfully, after a few weeks, I stopped blacking out and life seemed to get back to normal. And then I got sick again. Didn't know exactly what was wrong this time. It felt like the flu. It felt like I was starting at square one all over again. I couldn't breathe. I couldn't move. Everything hurt. Taking a deep breath, I felt like somebody was stabbing me in the lungs. Every time I would breathe, my lung would physically pop. And it felt like somebody was sitting on my chest. I had gone in. Again, they did their tests, said nothing was wrong, sent me home. I started having side effects from the blood thinner that I was put on, because at this point I was on an insanely high dosage, starting at 5 milligrams a day to now 10 milligrams a day and 12.5 milligrams a day. I started having reactions to that dosage and started vomiting blood. Thankfully, after a few weeks or so, that had stopped. It wasn't all the time, but it was fairly consistent with being 2 to 3 times a week that this would happen. It eventually had stopped, and I, for some reason, thought my life was coming back together and things were going back to normal. But every time I felt like I was feeling better, one thing would change and it felt like somebody had kicked me in the chest. Still to this day, they have not done another scan on my lungs to see how the blood clots are doing, if they are in fact dissolving or moving where they should not be. They unfortunately refuse to do another scan because of the amount of radiation in a CT scan. This is unfortunately something that I will have to live with for the next few years, being careful, hoping that one of the blood clots don't migrate to either my brain or my heart, because they have to dissolve naturally, and that's all there is to it. Unfortunately, as I had stated, I started having issues again with my breathing after they removed me from the blood thinners. To this day, it has been about a month since I was removed from them, and my oxygen levels do not like to stay above 90. And there's nothing they will do about it until they are consistently in the 80s. So each day I wake up, I test my oxygen. I also carry the meter around with me just in case, because my levels drop randomly and fairly consistently. I would say a few times a week they drop into the 80s out of nowhere. I can be having a perfectly normal day and then all of a sudden I can't breathe. My nail beds turn blue and pale, and I check my oxygen and we're really low again. Thankfully that doesn't last for more than 20 or so minutes, and then it kind of moves its way back up, but it still has not been able to get above 92 since I've been removed from blood thinners. At my doctor's recommendation, I did go ahead and receive the COVID-19 vaccine. After my second vaccine, I started to feel a little bit better. I'm in multiple different COVID-19 groups for other people that have had this virus or family members that know somebody who has, and we share tips and tricks on how to get better and feel better throughout, thousands upon thousands of people. Many people were stating that they had felt better after receiving the vaccine, and I thought it was just it was a hoax. I didn't believe them whatsoever until I had gotten the second dose of my vaccine. After a couple weeks, I did actually start to feel better. My chest felt less tight overall. I still have some issues breathing, and I still have bad days, but I find that I have those days a lot less often than originally after being diagnosed with this. Finally, after about 8 months, I am looking at going back into the workforce because my lungs and body are starting to become strong enough to be moving for more than a few minutes at a time without getting out of breath. It has been an everyday struggle with working on myself, fighting my depression and my anxiety to push forward and get out of bed in order to try to heal my body, because I know just sitting around and laying around isn't going to help. So every day I fought to get out of bed, to move a few minutes at a time, whatever my lungs could handle. Taking my dog for short walks around the block didn't always work. Had to take multiple breaks, but we always made it in the end. If the vaccine isn't right for you, that's okay. Don't do anything without making an informed decision.
My name is Courtney